Okay, you're on.
Good afternoon. This is August 31st, special meeting of the Board of Supervisors. Our first agenda item will be a discussion on possible action and update from the County Public Health Director to the Board of Supervisors regarding recent issues.
Chairman Bishop, can we verify who's on the phone?
Yes. Regarding recent issues, actions, events, and county responses regarding COVID-19, updates and taking any necessary actions based upon those updates. Madam Clerk, can you do a roll call?
Supervisor Angus?
Here.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
Okay, good afternoon, Denise. I'll turn the floor over to you for your presentation.
Great. Madam Chair, members of the board, I just received notice that there's a media briefing with Governor Ducey today at 3 o'clock, so I just wanted you to be aware of that. There's no other details here about what they'll be discussing, but I just wanted you to have that information. So per my normal, I'll start off with the numbers, that we have had a total of 3,553 cases in the county to date, 196 deaths. Average age of cases is 48.1. Average age of deaths is 76.4. This last week, we saw a 16% reduction of reported cases when compared to the previous week. And we have not seen less than 100 cases since the week ending May 30th. So we're definitely making progress every week, which is very good to see. I have some testing event numbers for you based on the Bullhead City testing event last Friday. They had 108 people enrolled and registered for that event. 82 people were tested. 4 of those were positive cases. Of those 82, what they've listed here is 25 of those were symptomatic, 57 were asymptomatic. Any questions there?
Anyone have any questions?
If I receive any additional information about that particular event, I will let you know. I also wanted to provide an update on the prison testing. That was delayed until today, tomorrow, and Wednesday. They tested a prison in Florence over the weekend and delayed the testing of our prison, so those results will come in probably later this week, early the following week. And we will keep you updated on what those look like moving forward.
Okay, thank you.
Okay. All right. Complaint inspection process. I did want to discuss and keep you informed and provide an update on some of our enforcement efforts. Last week, I believe Supervisor Johnson asked if we had any that had moved on to step 2 and step 3, and we do have a business that we will be moving on to step 3, which is the written warning portion of that. We have drafted a letter that we will be sending to the county attorney's office. I believe we're just finalizing that draft, and then we will get it to the county attorney's office for review before moving forward with sending that particular notice. But wanted to make sure that we could answer any questions related to that.
Does anyone have any questions relating to that? Okay, thank you.
All right. I forwarded a copy of the governor's long-term care visitation recommendations that were released on Friday. At the end of the day, those particular guidelines follow the same benchmarks as businesses. And I don't know if you've had an opportunity to review them, but it really does look at between moderate and minimal spread, what steps those particular congregate settings can take to open up visitation to family and friends. And we'll see, I don't know, they didn't list on the email that I received whether or not they would be creating a different dashboard for congregate settings or just following the same business dashboard and requirements there. So I will follow up with that and try to get an answer on whether or not you'll see a different dashboard available for congregate settings. Any questions on that?
Anyone? So we're a quiet board this morning. No questions.
I'm sure there'll be questions later, which is just fine. So, let's see. I've gone through my prison testing. Make sure that I've covered all my updates. I mean, it's been a busy morning, and I'm trying to respond to a number of questions, but I don't think I have any other particular points to make, but I would be happy to address any questions that you may have about any of our work. Or
Does anyone have any questions for Denise?
Madam Chair?
Supervisor Angus?
Yes, just going back to the prison testing. At our last meeting, we talked about and being the conduit from the board to the governor's office and seeing if we could make any allowances that those numbers not be counted in our county numbers. Has anything been done to that effect?
I have still not received a response from ADHS on that, Supervisor Angus, and I will follow through. I do have the health director's cell number, so I will try to reach her this afternoon to see what the status of our request is.
So a request was sent in. Was it sent by the board or from the health department?
So the board was going to be asking, based on my recollection from last Thursday, that the chairman of the board or the county manager was going to reach out to the governor's office to get a progress update. Am I correct?
Correct.
Okay.
And was that done?
Supervisor Angus, we're collecting information now prior to reaching out to the governor's office. We want to know some more detail and facts so that we can have a conversation and be able to communicate more effectively.
All right. And one more question. A report came out over the weekend that the CDC, I don't know if redid their numbers or reanalyzed the death numbers, and that they have revised the number of deaths attributed solely to COVID as 6% of all deaths, which came out to under 10,000 people. And so that kind of is sparring a larger debate about what those death numbers really mean, because that's the numbers everyone's looking at as we go forward to open up this country. Is there any discussion about the county re-auditing those numbers?
Supervisor Angus, we need
what
to...
those actual numbers are?
Sure. I need to look into that further before I can respond, and we'll try to have an answer for you as soon as possible on that, okay?
Sure, thanks, Denise.
Certainly.
Any other questions? Okay, no questions, Denise. Do you have anything else for us?
I do not.
Okay. Next item, this will be to approve the assignment of the Aaron P. Collins and Associates Incorporated contracts for consulting and wellness to the Gallagher Benefits Services effective September the 1st, 2020, and authorize the chairman of the MCEBT or her designee to execute documents needed to complete the assignment. We have Aaron
Madam Chair?
Collins coming to the podium. Good afternoon, Mr. Collins.
Can I?
Good afternoon.
Supervisor Angus, are you?
May I introduce this?
Supervisor
May
Angus,
I say something, Madam Chair?
I'm trying to acknowledge you. Go ahead, Supervisor Angus.
Okay. We had a P meeting last week, and we were asked at that meeting something that we knew was coming, and that was to reassign our contract with Aaron Collins to a new company. And although by law the trust would have been able to approve it on its own, that's the legal way of doing it, We thought that it would be better if it was brought in front of the whole Board of Supervisors for approval, and so Mr. Collins would be able to explain exactly what's going on with his company to the board, so there'd be no questions later. Thank you.
Okay, Mr. Collins.
Okay, Madam Chair, members of the board, thank you for your time today. I'd also like, if I could, just to lead off, because since we did the meeting and there's a huge interest in COVID, to segue into that other item by just giving you a quick update on the operations of the trust. Long and the short of it is the trust just finished a very successful year. The last 4 or 5 years in particular have really strengthened its financial position, and I tell you that because we're getting a lot of questions about how COVID is impacting the benefit plan for the county. As of July 31st, we had 143 tested individuals. This is every employee, spouses, and kids. 117 with known or suspected exposures, 4 confirmed cases, and $100,000 in spend through July 31st. Because of the fact that the trust has had some fairly good years, including this year financially, the long story short is the trust is very well positioned financially should those numbers escalate. As a point of interest, our clients are in all 15 counties around the state of Arizona. Mojave has had some of the lowest dollar impact on COVID. I can't explain why. I wish I could. Particularly those that have exposures up in the Phoenix metro area and up on the Navajo Nation have had very, very different experience. But for your sleep protection, for lack of a better term, I would just tell you the trust is doing very well financially and so far has had a fairly minimal impact from COVID. I'm going to move on if I want to, Madam Chair, and then if you have any questions, you can stop me. As far as the merger, effective tomorrow, on 9/1, ECA, my company, is merging with Gallagher Benefits. This is a process that's been going on about the last 2 years, started in March of 2018, the conversations, and culminated. Gallagher is a very deliberative, I should say this is a very deliberative process on our end of the world. Gallagher is very well known to counties in the state of Arizona and globally. They are the organization that put together the county's liability pool back in 1986. Ironically, I worked for Mojave County at that time, we called the personnel director, and then later the risk manager worked with them. I have since worked with them in Arizona, New Mexico, New Jersey, and London doing public entity work. From our perspective, the merger was kind of a natural one given that relationship. To be very candid and cut to the chase, it also does a great deal of service to our clients on the perpetuation and stability. IT is everybody's nightmare. It is for us too. So having the resources of a global firm will just add so much on that. But also, and you can see even in the current election cycle with the continuing federal involvement and state involvement in healthcare delivery, having those professional resources and backing with different specialty practices will actually enhance what we're able to do. You'll note the information. I gave you the entire packet, I'm sorry, Ken did in HR. Pardon me. You never want to cough in a public meeting anymore. But they just bring a wealth of resources that will actually, again, strengthen what we're able to do for the county in terms of how we work. Management, the service team, operating philosophy all remain in place. And then what we chose, and Ryan can speak to this as you wish, but we chose not to do a separate contract or a new contract. What we're asking for instead is that the contract be assigned because the team and everything will stay in place. And the reason we chose that option, Madam Chair, is that it takes the service levels, the pricing, everything that we have been contracted to do and brings it over to Gallagher intact. So you don't have to start from square one. That was our way of making sure that our clients knew that it would not, in fact, be changing in terms of any detriment to them. And I would just add a personal note. My company started here in Kingman over 28 years ago. It's the kind of the classic kitchen table consulting practice. Mojave County became a client first time about 20 years ago. There was some off and on in there. But we are now the largest in the state in our specific segment. We employ 6 people here in Kingman, 4 in Bullhead, 4 in Kingman, 2 in Bullhead, 1 in Havasu, and 6 in the Phoenix metropolitan area. And I always take pride in that, because I remember when I worked here and when I worked with governments around the state, that there's the great state of Maricopa and Pima and then the rest of the world, and I think it's kind of cool that a small company that started as a kitchen table practice here in Kingman and Mojave County wound up merging with the fourth largest company in that niche in the world. But I'm happy to answer any questions on any of that I can, Madam Chair.
Okay, does anyone have any questions for Mr. Collins? Supervisor Watson?
Yes, I do. Well, Aaron, what are your plans after the merger?
I'm contractually obligated to stay a minimum of 3 years. And what I tell people is that if 8 until I get my full Social Security benefits, I'll be here somewhere between that last heartbeat and 8 years.
And the next heartbeat. There you go. Aaron, it's been a pleasure dealing with you and your firm for a number of years. Done an outstanding job. Couldn't be more pleased. Thank you so much.
Madam Chair, thank you.
And congratulations on the merger.
Thank you.
Okay, anyone else? Okay, Aaron, I just want to tell you, I started out with the county a few years ago, and I think Gallagher was our provider at that time, so it's almost like going full circle. And I, too, appreciate all of your help and guidance over the years that you've been with Mojave County. So I look forward to the next 8 years.
Thank you, Madam Chair.
With that, I'll make a motion to approve the assignment of the Aaron P. Collins and Associates contract for consulting and wellness to Gallagher Benefit Services, effective September 1, 2020.
Okay, we have a motion on the floor.
I'll second that.
And we have a second by Supervisor Angus. All those in favor, say aye.
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 So we have 2 yes votes. Madam Clerk, could you do a roll call, please?
Supervisor Watson?
Yes.
Supervisor Angus?
Yes.
Supervisor Johnson?
Yes.
Supervisor Gould?
Aye.
Chairman Bishop?
Yes.
Motion carries.
Thank you very much.
Thank you, Madam Chair. Thanks.
Okay, the next item would be a discussion of possible action reference appointing Kayla Carr to serve as the Board of Director for the Yucca Fire District Board. Ms. Carr will fill the term vacated by Carol Lampkin for the remainder of her term, expiring following the general election in 2022, as required by ARS 48-803B. Supervisor
Madam
Gold,
Chairman,
go ahead.
I move that we appoint Kayla Carr to serve as a board member on the Yucca Fire District Board. Ms. Carr will fill the term vacated by Karen Lampkin for the remainder of the term, expiring following the general election in 2022 as required by ARS 48-803B.
I'll second the motion.
Okay, we have a motion and a second. Supervisor Gold, I would like to know, is this the only applicant that we have?
We had another person that filed a letter of interest. She never filled out the application provided to her by the clerk of the board. And she's ineligible because she's not lived in the district for 1 year.
Okay, thank you very much. So we have a motion on the floor. It has been seconded. All those in favor say aye.
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 Okay. Madam Clerk, did you get the vote? Okay.
You haven't asked for any opposed.
I just want to make sure you had the ayes because I couldn't hear everybody. Anybody opposed? Okay, motion passes. Thank you. This meeting is adjourned.